Life transitions don't have to be difficult. My guest today makes it look so easy. He went from Scott Santini Powell, one of the founding members of the rock and roll band Sha-Na-Na, to Scott Powell MD, a world-renowned orthopedic surgeon and professor at USC Keck School of Medicine. He is my guest today. Welcome, Santini. Let's talk.
Why, thank you, Rochelle. I'm happy to be here.
It's a pleasure to have you. So first of all, you got to tell me about touring with Sha-Na-Na, and did you really play at Woodstock?
We did play at Woodstock. That's a fact. We got started. We were a singing group at Columbia called the Kingsmen. Okay. Kind of an a cappella group like the Whiff and Poofs. And you know, we had a lot of huge gigs during the year. We played the psych ward at St. Luke's, the Yule log lighting ceremony. You know, heavy stuff. But there was a kind of a fad called trivia contests that started at Columbia. And so we were asked to come up with a couple of songs for the trivia contest that would be the answers. So they would say, who did the Five Satin, what song did the Five Satin sing? And it would be In the Still of the Night. So we'd learn that song. So we did a couple of songs and we put them into our repertoire, and we were playing at the Lion's Den, which was kind of a cafeteria on campus. And it was a year after the violence at Columbia. You know, there was the university was closed. There was a lot of protest against, you know, the war in Vietnam and houses and families, and this university was divided, and not just Columbia, but lots of others. And so we sang those two songs, and people started filing in and demanding that we sing them over and over and over again. But that's all we knew. And that evolved. We said, wow, what an idea. This is cool. So we got some gold MA suits and you know, played a couple of concerts at Columbia, and you know, we wound up playing at Woodstock.
How do you get invited to Woodstock from a band playing in a cafeteria at Columbia?
Well, we played a small club called The Scene. There was a guy named Steve Paul who managed Johnny Winter and a number of bands, but he had a club in New York in Hell's Kitchen called Steve Paul's Scene. And so we were trying to get gigs, and we landed a 2-week gig at Steve Paul's Scene. It was down in the basement. You know, the ceiling was about this high. I would say the changing room for 12 of us was about the size of the stage here. So really cramped. And but we were playing to, you know, the royalty of rock and roll who came through town would come to see the show. So, you know, one night you'd sit down and, you know, Jimi Hendrix would come over and say, I really like your guys' show. You know, we should, you know, do some shows together.
And you're like, whoa.
What?
Really?
You know, and Janis Joplin and Steve Steve Katz from Blood, Sweat and Tears, and it just went on and on and on. And at one point, in between shows, this kind of long-haired hippie guy came in the dressing room, and the bass singer was like, there's no room in here, get out of here. You know? And the guy goes, no, I got to talk to you. We want you to play Woodstock.
Oh, wow.
Which was, nobody knew what it was at the time.
Right.
So, you know, there were blank stares going, yeah, well, what's Woodstock? And he said, well, it's a festival, and he talked about the idea, and it's going to be 50,000 people, and, you know, we think it's going to be a really great thing, and we have these people lined up to play, and we'll pay you $300. Well, that's what got us. The $300, we could buy another amplifier, you know, so that was like, oh, man, you know. So we wound up playing there. It was our 8th show ever. We were the only band that didn't have a record contract, because it was pretty heady company, you know.
You think?
So, but the great thing was that Michael Wadley, who was the director of the movie, I was on a panel, you know, for the 25th anniversary, and they had a lot of cameramen and people, you know, who had worked on the film, and the cameramen described, you know, we went on right before Hendrix, so that was after 3 days. So people were exhausted. They had to fly in, you know, more film because they kept running out. And it was, you know, maybe 4 o'clock on Monday morning, and all the cameramen were just, they were out. They were asleep. They didn't know Sha-Na-Na. They figured they could take a break. And years later, they confessed that they thought they had taken some bad acid when they woke up to find us on stage. But it was, you know, Michael Wadley actually fought to keep us in this 2.5-hour movie, and it was 90 seconds, and it made us, you know, a household word.
And so now that you mentioned movies, so what are the three biggest movies of all time that you played in?
Gosh, I'm so glad you asked.
Yeah.
Obviously Woodstock, Grease, and Caddyshack, and that's my entire resume.
So,
and I'll take it.
And why not? I mean, but you even have a band now, the Fabulous Owls, correct?
Yeah.
Where
Scott
do you
Powell and the
play?
Fabulous Owls. We mostly do benefits.
You do.
It's a bunch of musicians, very high level studio musicians, that we will pick a place and do a show. We've made some CDs, and it benefits Music Cares. Right. I'm very involved in Music Cares, so
talk about that more later.
Yeah.
So I'm curious, what'd you do? You woke up one day after all this fun traveling and playing and getting on movies, and what did you say? I don't want to be an aging rock and roll star? Or what triggered you wanting to change from rock and roll to medicine?
I had a psychotic break from reality.
Okay.
No. No, it was funny because I had gotten a master's in drama while I was traveling. We did 4 years of television, did 100 shows on TV, and that's enough for what's called stripping, to do it 5 days a week. So we figured the light was at the end of the tunnel, and we didn't get picked up for the 5th season. And I was doing the movie Caddyshack. I thought I wanted to act in movies. I thought that'd be natural extension. Why not? And so we were in Florida. A friend of mine was the producer, and had me down there for a small part. But I was there for about 3 months, and it was a great set. I mean, look, Bill Murray, Chevy Chase, the writers from Saturday Night Live, Harold Ramis, just Ted Knight, Rodney Dangerfield. It was a comedy playhouse. Fun. It was hysterical, and I thought, I love acting. I love the movies. This is fantastic. At lunch one day, Henry Wilcoxon, who had been a star for 150 films, he had been, I think, in El Cid and Ben-Hur, and acted with Claudette Colbert, and he was the real deal in Hollywood. And he stood up at lunch one day and said, "This is the best set I've ever been on." And I thought, this is the pinnacle of my movie career. It's downhill from here. I maybe ought to look for work.
Coming from that guy.
Coming from that guy. So
that was the moment.
Well, it got the process started. Yeah. It said, and I knew I didn't want to be a lawyer. In the music business, you don't have very good experience with lawyers. I had done a lot of business stuff, but that going into business per se didn't interest me. And I started writing a play with some people from Chicago. And one of the characters was a doctor. And we tried to write dialogue, and it just didn't sound right. So my college roommate was up in Boston doing his fellowship in vascular surgery. And so I went up to talk to him and try and get a feel for what a doctor sounds like. I spent a day in the library and sort of, this is pretty nice. I'm using my loaf again. And then went in and scrubbed with him in surgery, and kind of watched, and it was pretty interesting. And then I went and saw a patient with him, and so I'm in my little white coat, and he's talking to this. It's a VA, mind you, so a 50-year-old burnout alcoholic on the border of liver failure, and my friend is telling him, if you don't stop drinking, you'll be dead within 6 months. We have an operation that we can do. But the operation, the likelihood of you dying on the table is about 20%, and maybe leaving the hospital another 20%. So, he's having this very sobering conversation with this guy. And I'm sitting there looking, going, my work life has been playing to the back of a 30,000 person venue looking for people to hit their lighters in admiration.
Right.
And it was just a very different relationship to an audience,
more personal.
Well, yeah, one-to-one,
right.
And just very different. And I thought that kind of is intriguing. Mm-hmm. And then as I thought about it and talked to friends, you can work forever, and I was starting late, and so I didn't want to have a cap of retiring at 65. And then I got interested in surgery. It's basically, I was building lofts in New York, what I do today is carpentry on the human body.
It's awesome.
Yeah, so it's fun.
And
the stories are great. Everybody who walks through the door has a story, and they want to tell their story, and you get to listen.
And you have a good bedside manner too, as they say.
Well,
so why'd you choose orthopedics, and then you went into arthroscopic
surgery? Yeah. Yeah, I mean, orthopedics was it's a craft. The people are interesting. The patients want to get better. They're very motivated. Something's broken, you fix it, and the great day that you have is when you send them out the door. They're a graduate, they get to go back and do everything that they want to do, and you've helped them achieve that part of their, get back to that part of their life. Yeah. So it's very satisfying.
And today you have 2 offices. Tell me where your offices are.
I do. We have an office in Burbank, which is right next to Disney, and so we have a lot of patients who are, behind the camera. And they're great folks they like coming to me. Not that I'm great, but I know what a grip is. I know what a best boy is. They don't have to explain themselves. Yeah. And I've been in the business, so I think there's a level of comfort there. And then I have an office in Santa Monica that I share with my wife, Cynthia Boxford, who's an eye plastic reconstructive surgeon and way overqualified.
An oculofacial surgeon.
Oculofacial, yeah.
New word I had to learn. And before we go to the next segment, any guidance for us rock and roll stars that might want to make a life shift? What's the first? I know you went out, but what's advice you would give them?
I guess I can only say from my own experience, which is I never thought about the road ahead. I stayed in the moment, and I just sort of went step by step. I didn't know if I could pass chemistry. I didn't know if I was a science person because I had been music and English and the other side of the brain. But I just put one foot ahead of the other, and I just took it where it led me. And that's kind of the advice I give to my kids.
That's great. Well, you're doing awesome. So we're going to find out more about you in a moment. So, whatever life transformation you may be experiencing, own it, enjoy it, live in the moment. Become the best you can be, one step at a time. Whether you're moving into a new phase of life, retiring, or just need a change, it is all about attitude. We are talking with Scott Santini Powell of Sha-Na-Na. We will find out about Scott Powell MD when we return to Let's Talk.
Discover 30 years of opera in Santa Monica. Discover the Verdi Chorus.
I don't know about you, but every day upon waking, something else on my body aches. Dr. Scott Powell is a leader in the field of orthopedics and sports medicine. He is exploring new ways to push our bodies to their reasonable limits, permitting us to do things that we thought were in our rearview mirror, all without surgery. Let's talk about what's working for many in relieving pain in our bones and our bodies as we age. So, Dr. Powell now, we talked a little bit about biologics, and I'd like for you to share with our audience what are biologics, what's the history of them, and how are we using them today? Just start with that.
Sure. Biologics are probably the most significant breakthrough in medicine in 50 years. The biologics I'm referring to are platelet-rich plasma, or PRP, and then stem cells. A little bit of the history, platelet-rich plasma is your own blood that's spun down to concentrate the growth factors to help stimulate the body to cause an acute healing response. In the mid-90s, cardiac surgeons who were doing bypasses used this technique to help enhance the healing of their grafts. And then it expanded for use in other areas, other fields, maxillofacial, dental implants, and into orthopedics. It's been used extensively in probably the last 10 years for taking care of tendon injuries, Achilles tendon, tennis elbow, and in addition, well, we've started to inject it into the joint, the arthritic knee, the arthritic shoulder, because there are a certain number of stem cells, probably 50,000 stem cells in the injection that we do. It's not that we're creating cartilage in the arthritic knee or shoulder, but it has such a strong anti-inflammatory component that it relieves pain. And so that's our goal. Stem cells really have been around for a long time. I think people will undoubtedly remember the controversy of 10 years ago when there was a law passed in California to allocate $3 million to research stem cells to get more stem cell lines because there weren't that many that were approved by the federal government. The researchers at UCLA started doing work trying to isolate where stem cells came from in the body. In addition, the plastic surgeons started injecting fat into people's faces to act as filler, because as we age, the face starts to sag, and so you can bulk it up and give a more youthful appearance. What they noticed was that the skin in those areas became very radiant, very, luminescent. And between the basic science research and the sort of observations of these plastic surgeons, the researchers realized that there are stem cells in fat. It's not just stem cells that have already differentiated, but there are juvenile stem cells, what are called pluripotential stem cells, that can then be transformed, injected, used to repair tissue. So that's become a very exciting area. We're all walking around with our own supply of stem cells
within our own bodies.
Within
so
our
we
own
use our
bodies.
own stuff on our own.
Exactly.
Healing. Right.
It's your own material. There's no risk of rejection. And you have these stem cells that have yet to differentiate. So there's areas of research and spinal cord injury, obviously with all the injuries from Iraq and Afghanistan, to help bones heal, for arthritis, for creating insulin cells for people who have diabetes. So it's an incredible window and the most exciting thing that's come along.
Endless possibilities.
Yeah, endless possibilities.
And so, when I was doing a little bit of research, what's the difference between biologics and drugs to relieve pain? I know biologics are from our own materials, but
Correct.
There's that line between. What do you tell people when they say, why don't you just give me a pill to relieve the pain instead?
Well, an anti-inflammatory pill, an Aleve or an Advil or something like that, you would have to take 3 times a day. Now, I have terrible arthritis in my right knee. If you looked at an x-ray or an orthopedic surgeon, well, even the layperson could tell, there's really bone on bone. There's nothing there, okay? It looks terrible. But I had a stem cell injection in my knee 2.5 years ago, and I have no pain. I can bike 60 miles on a weekend. Now, look, I'm not 18, I can't play basketball, but I'm saying I live a fully functional, active life, even with this terrible arthritis. And it's not because my x-ray has changed or I've grown cartilage. Look, if we know the trigger to get cartilage to grow, that's the holy grail.
Right.
People won't have to have total knee replacements. We'll just be injecting them. But we're not there.
Right.
But what we do have is a significant tool for pain relief.
And so that was one injection?
One injection.
And that's lasted, so we'll get to that. So does it always work? How long does it last? I mean, yours has lasted 2.5 years.
I was the guiney pig, so I'm 2.5 years out. But anecdotally, we had a waitress who was married to an actor and was on her feet all day long, limping terribly, was at the point of having to stop work. She came in to see us. We did the procedure. She came back to the office in a week, basically so thankful, in tears. People said, "What happened to you?" She's working, no limp. She still has the terrible arthritis and she's got a terrible x-ray, but she's fully functional, and it's very
pain
exciting.
relief. That's so
Pain relief, yeah. It's such a strong anti-inflammatory.
So you mentioned arthritis, and then you mentioned the shoulder. How do you use them in the shoulder? I mean, is that just like for a tennis player? I mean,
well, there are a
what
couple
other
of
treatments?
yeah,
can be used?
there are a couple of things. For example, when we do rotator cuff
Rotator
repairs,
cuff. Okay.
you know, again, that's an entity. Probably half the people in the country over 65 have a rotator cuff tear, so it's very common. They don't all hurt, so we obviously don't operate on all those people. But the ones that begin to hurt, you know, we consider after physical therapy and injections. We consider surgical intervention. And one of the things that we do is to use implants or screws that are actually have a hole in the center. As they go down into the bone, you see the rise of stem cells from the bone marrow, and that comes up to help the repair. I did some work 10 years ago trying to use this platelet-rich plasma and injecting it under the repair, and I could never really tell whether it was helping or hurting. You know, we didn't have enough number of patients really to be able to tell if there was a difference. But you know, now we do it just because empirically it makes sense. Why not?
Yeah, exactly. You know? Especially without surgery. I mean, it's without cutting.
Without cutting. I mean, in that setting, it's surgery. But I mean, you know, we're all looking for ways to enhance healing of the human body as minimally invasive as possible.
Yeah. So speaking about the actual procedure, so it's just an injection? I mean, what does that entail? Just tell me. If I was going to come to you, I have an arthritic knee, as a matter of fact. So what would you say to me?
Well, after explaining, you know, where the stem cells come from, it's basically a liposuction type of procedure. So you're sedated for that. Okay. Yeah, you just make 2 little incisions and take out the fat, and you spin it down and concentrate it, and then get rid of the used stem cells, if you will, to save the juvenile stem cells. And through processing and you know, centrifuging, you get it down to a couple of cc's of juvenile stem cells, and then you just inject it into the knee. So the procedure takes about 2 hours.
And so we just see how long that lasts, and so that's based on the patient. Or
well,
how frequently would you have to do that?
I don't know the answer because, as I said, we're out 2.5 years,
right. And you haven't. Right.
And I haven't thought about having another one yet. So. You know, we'll see. And it's not 100% effective. It's 80% effective. Okay. You know, but that's pretty good. That's as good as some of the surgical procedures we do.
So does insurance cover it? I know you get that question a lot.
No, it doesn't. It doesn't at this point. Interestingly enough, workers' compensation is very often the leader in these new, you know, methodologies. So we've submitted to them several times for you know, because what we're looking to do is prevent knee replacement, prevent these big procedures that you have to be out of work for months and months and months.
And somebody has to pay for them.
And somebody, right, and you know, knee replacements are not inexpensive. Right. So I suspect that the first people who will come along will be you know, workers' comp. For example, they covered platelet-rich plasma before. Well, there are no other insurers who cover it even now. But you know, I worked with the U.S. women's soccer team, and we treated a lot of those patients, those players, with platelet-rich plasma for, you know, sprains and, you know, Achilles tendonitis, that sort of thing, and had tremendous result. And the payer is happy to get the player back on the field.
Oh, absolutely. And all that comes from the player's body.
Exactly.
So it's not like you have to go get it from anywhere else. So you're just self-producing your own remedies.
You draw off the blood, you spin it down, and you inject it. And
so how much does something like that cost? I mean, I'm just...
No, cost is a real, you know, is a real issue. That is $750 for an injection.
For an injection, and that covers getting it out of you and then putting it back in you.
Yeah, for the platelet-rich plasma, it's a blood draw.
Okay.
You know, the stem cells are expensive because nothing is covered by insurance there. It's about $10,000.
Right. To do the lipo and then do the stem
cells. Right. It's 2 surgeons, an anesthesiologist, a surgery center.
Right. That's a whole.
You know, the staff. It's, you know, it's a 2.5-hour procedure, if you will. So as opposed to the PRP, which is 15 minutes.
What happens if it doesn't work? What do you do then?
I think at that point after discussing the options with the patient, I mean, usually by the time they come for that procedure, the next step for them is a total knee replacement.
Right. They've already gone that.
Right. They've gone through
yeah.
all the conservative managed physical therapy, arthroscopy, Synvisc injections, hyaluronic acid, all the things that we do as a part of the algorithm to try and hold off on any, But we're reaching a point where the baby boomers are getting to the age, and we've lived very robust, full, active lives, and although most of it is genetic,
Of course.
it does have to do with the fact that we've been pushing the envelope for a lot of years, and so.
And we're going to continue to push it.
We are, and that's our goal is to keep that envelope far away, and the total knee replacement,
Yeah,
back in
as
the
far
background.
away as possible.
Exactly.
Well, it has been a great pleasure having you on the show.
Thank you so very much.
Next time I'm going to have you sing.
You're on. Just don't ask me to try and get in that goal MAC.
Okay, I promise I will not. Our program is brought to you by the Commission for the Senior Community, focusing on preserving and improving the quality of life for Santa Monicans 60 and older. For more info, visit our website on the screen now. Thank you so much for watching Let's Talk. Till next time, be well, live well, age well.